Hello, my name is Mandy Gallagher. Today I will be discussing a message board system that is displayed in local hospitals as a patient tracker device for family members to see what's going on with their loved one who just became our patient. This project is for the Nursing BSN program at the Lock Haven University, Clearfield campus, spring 2019. Introduction. Today we'll be discussing what is health informatics, what is HIPAA, what is health service message board systems, how is HIPAA maintained with the health service message boards, the benefits of the health service message boards in the delivery of quality patient-centered care, the process of monitoring the message board system as a family member who is monitoring their patient. The conclusion. There are many different types of information systems in the healthcare industry. Each of these perform a particular function, but in the end, they are all there for one purpose, and that is to make sure that the patient is correctly diagnosed and is well on their way to a better healthcare outcome. In this presentation, I'm going to introduce to you a patient tracking message board system used for surgical patients in our local facility. I'm also going to explain how to understand what you are looking at when reviewing the message board system. Health informatics. According to QSUN, health informatics is the use of information and technology to communicate, manage knowledge, mitigate error, and support the decision-making process. The benefits of the healthcare informatics are promoting meaningful use of electronic health record technologies to allow for improving the quality of health care through the electronic exchange of health information, which provides patients and their families access to personal information via portal systems such as message board systems and patient tracking. Healthcare informatics also improves the patient's overall care coordination. With the advent of electronic health data, Congress in 1996 enacted HIPAA, which stands for the Health Insurance Portability and Accountability Act. The HIPAA privacy rules was enacted in 2003 to establish standards for the protection and disclosure of patients' health information, and specifically defines the identifiable protected health information, which includes the patient's identifiers such as the person's name, date of birth, pictures, medical diagnosis, address, social security number, etc. HIPAA stipulates the information that may be used, by whom, and under what circumstances they would be allowed to be used. Privacy and confidentiality. Did you know that they are not the same? Privacy relates to the patient's right to dignity and respect, and for personal information to be held private. Confidentiality. This is a disclosure of information with the patient's consent for healthcare purposes when they are legally required. Healthcare informatics is seen as a potential method for improving the delivery of quality healthcare by providing up-to-the-minute real-time information about a patient's whereabouts in real-time documentation. The patient is given the identification number. The patient's number will then be displayed on a monitor system for the family to track where the patient is at all times, such as the patient is in pre-op, anesthesia, active surgery, or post-op or recovery. This allows the patient's family to be prepared to care for their loved ones after the procedure is complete. In a world of technology, computers are needed in different aspects of the patient's care process. In the surgical waiting rooms, the surgical information system can be employed to enhance the communication aimed at healthcare practitioners and the patient's family. On this slide, you will see a message board system, which allows for the family to monitor the patient's whereabouts at all times. For this particular message board system, you will see a column with name. This would be the provider that is doing the patient's procedure. Next, you will see the patient's identifying number that is given to the family so that they can track the process. After that, you'll be able to see what procedure is being done at that time. Then with a location, the family will be able to see where the patient is in their process, such as allowing the family to see where the patient is located within the facility at all times. Lastly, the status column. This is the status of the patient's procedure, such as scheduled, confirmed, canceled, in progress, or complete. The process. The patient would arrive to the facility, find their designated surgery area. The patient would then register and receive a patient identification number. The family can now start the monitoring process for their loved one. The process continued. Next, the patient is called back into the room to get prepared for the procedure, such as change and get vital signs done. They are now in the holding room, which is displayed on a monitoring system in the waiting room for the family to track. When the patient is taken into pre-op holding area, this is where they will discuss the procedure with the anesthesia. Pre-anesthesia will be displayed on the message board system. The patient is then taken to the operating room, where the family will see anesthesia in progress on the message board system. The surgeon will then come into the operating room and start the procedure. That is when procedure started will display on the message board system. Once the procedure is complete, the message board system will display to the family that the procedure has been completed. The patient is then moved to the holding recovery area once again, where recovery will be displayed. Lastly, the patient will be moved back into the original patient room, and then the message board will show that the patient is ready. This will allow the family to know that they are able to go back to the patient's room to be with their loved one while the patient is waiting to be discharged for same-day procedures, or for the patient to be admitted to the room where they will stay for the duration of their recovery time. Patient tracking, message board systems. Surgical patient tracking systems vary for each facility, but they all provide up-to-date information for the patient's family to monitor the process. Throughout their entire process, from admission to discharge, the patient tracking device message board systems help provide a continuum of care for each individual, allowing for a better outcome for patient-centered care. Conclusion. Barcoding will allow for a better patient tracking. Patient care, alerts, reminders, such as message board, patient tracking devices. Increase patient and family satisfaction, which also allows for more positive patient outcomes. There are many domains inside the hospital setting that requires the latest and up-to-date information. There are many different types of information systems within the healthcare industry. Each of these perform a particular function, but in the end, they are all there for just one purpose, and that is to ensure that the patients and their families are well on their way to a better healthcare outcome with greater safety and satisfaction. Message board systems maintain the role of HIPAA confidentiality by giving the patient an identifying number and never using the patient's name during the entire process.